Good afternoon, everybody, and welcome to FUH Leaders Talk. Today, we will have a discussion with our Director of the Academic and Training Affairs, Dr. Vito. He's going to introduce himself in a moment. My name is Marlies Klok, and I will be your host of this afternoon. I am the Senior Manager of the Academic and Training Affairs. Good afternoon, Dr. Vito, and welcome to this talk. Really much looking forward to it. Would you like to introduce yourself?
Thank you, Marlies. I'm Vito Annese. I'm a consultant gastroenterologist from Italy, and I get to start with this adventure with the ATA from July now, being in the FUH from an early beginning before we get started, I will say.
Very good. Nice. Thank you. Nice meeting you. And it's really a pleasure that we are here today with you. When we are talking about FUH University Hospital, we are always mentioning three pillars. We are mentioning that the care here is based upon technology, that we will have a healing environment for patient and staff, and of course, academic care. And academic care is already in the name of FUH University Hospital, and this is of course under the umbrella of the Academic and Training Affairs. The vision of FUH University Hospital is to be a role model in the region for patient experience. And the vision of the Academic and Training Affairs is that we want to be a role model in continuous education for healthcare providers, patients, and our future colleagues, of course. We are a university hospital. So today we're going to talk about these three pillars. Let's start with the first pillar, and that is the growth and the development of healthcare providers, of course, FUH University Hospital staff members, but also everybody who is living in the UAE and is a healthcare provider and outside the UAE as well. Could you tell us a little bit about the activities that we're doing in the Academic and Training Affairs?
Yeah, thank you. Well, the education, training, and knowledge in healthcare is fundamental since, there has been an estimation that the knowledge is doubling over time. And what is curious, then in 1950, it was estimating a doubling takes place in 50 years. In 2010, it was estimated to take place in 5 years. And actually, in 2020, it should change in 5 months' time. So that's amazing how the knowledge, the sense will progress. And now we have to run behind also to keep the education, the training, and the retraining up to date. So that's the way we have to do in the daily practice with the continuous medical education, which is not just from physician, it's for all the healthcare providers. So what we do is organize periodically, I would say on a weekly basis, sometimes even more than one every week, CME accredited initiative. It can be course, can be our grand round. Grand round means that all the hospital is frozen for 1 hour, so there are no clinical activity. And all the healthcare providers are gathering together to be updated on the scientific progress, case report, and review. And then, of course, there are courses which are more long organized in terms of having several aspects of the training, and can be eventually even hands-on course. So there is the possibility to use new technology, robotics, or digital possibility, to improve our education. And this is something that is done in-house, face-to-face, but also in hybrid format, as COVID in some way is driving in this direction. So the possibility that even from other countries and other researchers can join our kind of initiative, and this will enrich, of course, our knowledge. And this is something that we look forward that, for example, in December, we are going to make a very big symposium, as you know, that will span in 2 years, in 2 days, about obesity, which is one of the pandemic. We like to talk about COVID, but this pandemic of obesity, together with diabetes, with increase of cardiovascular risk, we will touch 360 degree all what is around obesity.
Yeah. And I'm really, really looking forward to that. And I think it is also what you were saying as well, is that you will see in the activities that we are organizing in FUH University Hospital that there is always a great collaboration between the different departments and also on a multidisciplinary level. We would like to showcase here in FUH University Hospital that we are working together as a team and that the patient is central in that collaboration as well. It is nice indeed that you're mentioning that sometimes we see that COVID brought us good things, and one of the good things is the e-learning platforms and the remote education, the hybrid forms of education. What makes that education can be now faster reaching the healthcare provider. And if you're saying that knowledge needs to be doubled within 5 months at this point in time, then I think we are depending on hybrid modes of education, whereby we then can reach a bigger audience. So that is indeed very important. Maybe it's also good to mention that we have a research department and that we are collaborating in research.
Well, again, I'm done in all my career since the early beginning of research. To me, a combination in their daily routine practice with research is the best way to offer the best to our patient, to be updated, to be stimulated by the research. The progress is done by research. It's not just with good idea. You have to test in the practice if the good idea is true, and that's the scientific way to make progress. So research means to do what we call clinical trials. Clinical trials need a specific regulation, what we call good clinical practice, and need some regulation body that should look for that. So basically, what we call ethical committee or internal review board that should be done locally and then eventually at the country level or emirate level in this situation. There is a body that is belonging to Dubai Health Authority, which is the Dubai Scientific Research Ethical Committee, which is superintend all the initiative of research within the Dubai Emirates. But we internally, we are forming and will start soon what is called an ethical committee, so IRB, where several entities that can be physician, nurse, expert in quality management, legal, and statistician will get together to evaluate the finality of any kind of clinical research, if they are scientifically sound, if it's safe enough for the patient, it will progress in a scientific way, and then will be eventually approved and put forward. And that's the way also to offer to our patient eventually new medication, or to go back what you have done, what we do retrospectively. So evaluate our evaluation of outcomes in the specific patient and see if we're done properly or if we can do better.
Yeah, and I think as well that these outcomes are again used for further education and can be put into grant rounds and can be put into CME programs again. Maybe it's also nice mentioning that we have a life support training center, and that at the moment here in FUH the life support trainings can be done for our staff is done internally. We are going to expand next year as well, and making sure that we are going to reach the public and that we're going to reach other healthcare providers within the UAE to offer these trainings, and to offer as well the community a form of life support, CPR, hands-on training. As you were saying, obesity is also leading to more cardiovascular diseases, and it is important that more and more people are going to recognize the first signs and symptoms of cardiac arrest, heart attack and cardiac arrest, and that they can actually support family, friends or bystanders so that there is a better chance of survival from outside the hospital. So that brings us, I think, to the next pillar of the academic and training affairs, and that is that we want to empower our patients through education. I think for us it is very important that every patient here is making an informed decision of their care plan together with their physician. Am I right?
Well, that's curious. In a period where we have so many information coming from the web, from the social, and from the video, people get even more confused because there is no way really to filter, to understand if what we read, what we listen is real, is scientifically sound, is legal. And that's our scope as a healthcare provider. So to filter all the information and to give the information they are in some way documented and are scientifically and also ethically valid. So information of the patient comes also because sometimes there are language barrier, racial barrier, or education barrier, education difficulties. So we have to find a language which is completely understandable and completely shareable across many age, because we can even have situation of very old patient and sometimes have difficulties in understanding, or we can fare with the family of children. Then, of course, they cannot give themselves their consent. And we, as parents, we know how difficult it sometimes is to take a decision for our children. So education comes with a direct relation with the patient, comes with providing them material to, to read that, I will say, digest that kind of information. Sometimes at the first approach, there is an anxiety. There is not a perfect environment. There is even not time enough to all the questions. So having, for example, e-platform, so platform available online, give the opportunity to any patient, family members, or community in general to approach this information. And eventually we may try in the future even to have a kind of, interaction, can have a chat on that.
Yeah.
So not a kind of dead body there as e-platform. E-platform can live itself. So eventually the patient can interact, and the healthcare provider can accept also this platform. It's not just for the patient, the family members. It's something that can be used also for healthcare provider, even a kind of accreditation of their knowledge from time by time.
Yeah, definitely. I think it is also, you were saying indeed that we are very much caring about care for family, and that is not even in FUH University Hospital starting after the birth of a child, but where we already starting before the birth of a child. We have a beautiful program that is called FUH University Hospital Life Parenthood, whereby we really are taking the parents, the new parents, into their journey. We accompany them, we guide them, we give them the information that they need to make decisions about their the pregnancy, about the delivery. We give them hands-on practice to care for their baby, to go home with their baby. And in a country where so many expats are living that are away from their family, away from that safe village that we need around our new family, around our newborn, we are trying to provide that village, and we're trying to be that support group from the beginning all the way till your children go to university if needed.
No, that's a great initiative, and bring me also to underline the concept that sometimes there is a misconception that people come to the hospital when there is something wrong. So pregnancy is a physiological situation, and so having information for the pregnancy, for the delivery, is absolutely wise. Also because brings some anxiety, and also brings to me to stress the importance of prevention in general.
Yes.
So the information for any kind of possibility risk that we face during the life. So prevention is for healthcare provider sometimes is more important than a cure.
Yes.
Because the prevention may avoid the problem, and so that there is a much great deal there.
Yes, definitely. And I think this is very important indeed to stress on. And this is why you see continuous awareness sessions here in the hospital this month as well. It is Diabetes World Day, and we will have a session here where we focus on how to recognize signs and symptoms, how to stay healthy, to make the right choices in your life to prevent this kind of diseases from happening. Last but definitely not least is that we are FUH University Hospital, so we are caring for the future of healthcare, the ones that are going to take care of us when we are old and retired. What can you tell about this part of our academic
Well,
care?
that's a great responsibility that brings back to when we start studying, and what we were expecting for the future, the information that we eventually miss in that situation, how should have been our future. And also remind to me that we come from an important legacy from our mother group in Jeddah that already started, paved the way of the education done in academic way. So not just a simple education, but a formal and recognized and accredited education. So we get started indeed, and we get started from the beginning. So sometimes the facility, the hospital comes to the education and the training after a while. We were somewhat striving to do that from the early beginning, and we have started already with the undergraduate student. I would say even earlier we have started with the first degree of second degree student that comes also to give a look at the hospital, to give a look at the possibility eventually to work in healthcare. And then we start having some kind of agreement with other facilities, other university, having an agreement with them to receive their student and to form there in practice. The student rotated in different facilities, including our own. And so they also see different aspects of the care, different kind of organization, this enrich also the culture and their education program. And we move further now, and we already start with the postgraduate students. So there are doctor already, or eventually nurse, that already finished their course of study, but they have to move further, or they have to, close some gaps because eventually, for family reason, they have to stop their activity because they can move to a residency program, for example. So we make this kind of opportunity of gap closure. We give the opportunity to have internships, and we will be even further to have residency program. We start the collaboration with Dubai Health Authority, and we start the collaboration with the National Institute of Specialties to get the accreditation to start the residency program. And we have the tradition on that of what is done in King of Saudi, and we are applying just in this day the residency program. Thanks to your work, Marlies, for hopefully to get the accreditation for the residency program, starting with internal medicine and family medicine, and then we will move forward to other specialties.
Yeah. I'm really, really looking forward to that. I think the environment of being a university hospital and to have students from all different levels will make the environment alive, and it will also keep us as healthcare professionals on our toes, because we all know that students have the most curious questions, that they are on top of the newest knowledge and scientific research. So we need to keep ourselves up to date in order to facilitate the needs of the students. And I think that is the beauty of having students in a hospital.
That's absolutely right. So I'm in the field since a while, and probably will retire in a few years' time. But what makes still alive and still very passionate is the research, the meeting, the scientific meeting, and the interaction with the students.
Yeah.
So the energy that we can achieve from the students is unique.
Yeah.
And the stimulation to do better and better in everyday practice is something unique coming from their fresh blood and energy.
Yeah, definitely. I would like to tell you that over the last 16 months, 17 months, since we are accredited as a training facility, we accommodated over more than 200 students. Medical students, of course, lots of pharmacy students from undergraduate to now we have the PharmD. We have many students in the radiology, the technicians, students in the lab, in physiotherapy. We have students that are here from the local universities, but we have also students that are coming from abroad and are really, really keen on looking into the healthcare in the UAE. So yeah, it is an absolute pleasure to have them around, and it keeps us up to date with everything, I would say.
And stimulating.
And stimulating. And I think it is also important to stress that we believe that the private hospitals do have a responsibility towards the growth here in the UAE to make sure that healthcare is evolving. And the collaboration with DHA is very important for us.
And what I feel also, this competition amongst the government and the private care in terms of education and in training, which is a kind of win-win competition. So we will, for the country and for, as we say, for the doctor and healthcare provider of the future, do our best. And we feel, personally, I feel the responsibility on our shoulder, to do our best and to provide our best, as long that we have learned during our career not only how to treat, how to care the patient, but also to improve the science.
Yeah, definitely. One of the things that we are asked a lot about is what will be the role of artificial intelligence in healthcare and in academics in healthcare as well?
Well, that's a great. I mean, the future is already here. This kind of machine learning software in some way already have overpassed the possibility of the human beings, the human possibility. For example, it's estimated that so far artificial intelligence can make a correct the radiologic diagnosis in encompassing more than 80% of radiologists in terms of expertise. And I'm afraid my son is radiologist, and I say, look, you have to do always better and better, because sooner or later artificial intelligence will do better than you. But in general, we have not to be scared of that. So we have to, in some way, teach the artificial intelligence, this kind of machine learning system, how to provide our students more, sophisticated and experience kind of answer to our question. There are diseases that are very complex. I'm used to say diabetes is somewhat easy for diagnosis. You check glucose, and you know that there is diabetes there, but there are a lot of symptoms complexity and syndrome complexity that really needs a lot of experience to reach there. So artificial intelligence will close the gaps. So even the very young healthcare providers, with the help of artificial intelligence, will save time and hopefully will save life. So that is something that is coming in the daily practice, not only in the care of the patient, but will come soon also in the education of the healthcare providers.
Yeah. And I'm really looking forward to that. Although I believe that we will never be taken over by artificial intelligence, because the human touch, and if we're talking about a healing environment, then the human touch in the healing environment is detrimental and will never be taken over by artificial intelligence. We have some questions in our chat. I would like to say, somebody is suggesting to invite school trips to visit FUH University Hospital and let students have orientation and information, which is then delivered to parents and their families. It's funny that somebody is making that comment, because we're very active in that. We have our unique FUH University Hospital Workplace Experience Program. This is a 5-day program for high school students who are exploring the possibilities of a career within healthcare. It doesn't have to be always, I want to be a doctor, I want to be a nurse. Some are really interested in engineering, for example, radiology, the technical side, some even into the financial side of healthcare. So all these different aspects will be touched on in this program, and they will get an overall view in who is working in healthcare, and people will be surprised to say that we have over 24 departments actually working in healthcare. So this program is in place and will soon be shown into our website, and people can apply via the website as well. Another thing that we are doing, we're looking forward as well, is that we are inviting even younger children to the hospital. Some are requesting school trips, and we are more than happy to collaborate if possible, because we want to indeed show also the little children that there is nothing to be scared for in a hospital, that it is all about helping, supporting, and that there is a lot that everybody can do to prevent coming sick to a hospital. So also with the little ones, we will talk about prevention. So definitely we are going to collaborate.
Yeah, I think this is absolutely nice. Indeed, you have done a great job so far, and probably, we have to share more this information website as soon as possible. I was thinking as you were talking that, in the perception, some people, once again, the hospital is the place of the sick people and of the nasty smell.
Yeah.
It's not that case if you see the environment here. And once again, that when they touch the technology, the digital environment, the smart possibility, they are here. And what we do also in terms of education and prevention, that is absolutely obvious that it's a very important information for the community.
Yeah, definitely. Somebody is asking if we do post-MBBS courses. I think we already touched on that. That question was already answered in our talk. Other than that, Doctor, what is the future?
Well, the future, I guess, is bright and will be tough for both of us, because we have the responsibility to do better and better, also because our senior management is, very demanding, and it is the way to do better and better, and also try to, to invent something that has not been done already in the countries. So try to be innovative, as all the senior management has done so far for such kind of FUH family. And once again, the responsibility that we put as in the care, also in the education. So it is important as the care having a good, scientifically sound and ethical education.
Yeah, I agree 100%. And the future is definitely bright. It's an absolute pleasure that we can contribute on the development of this beautiful country that has given us so much. And it is really nice to give something back as well to the community and the people of the UAE. Thank you so much. It was a pleasure. And I hope everybody enjoyed. This was FUH Leaders Talk for today. And we're looking forward to see you soon. Goodbye.
Thank you.